recommendation is.
So actually,
Yes, that is what the
Shivani, what
recommendation
we
is.
need to see here that influenza shot, yes, we need to get the annual vaccination done every year in the month of August. I say precisely August every year. The current circulating strain is as such by WHO is recommended that it's to be as such given in the vaccine, and every year it is recommended to be taken. Now, who should definitely take the influenza vaccine? So I want to highlight people who have comorbid illness, people who are elderly, people who had recovered from a bad lung disease. I will add, nowadays when all these guidelines were made, like before COVID, so COVID infection also had a severe damage to the lungs, especially we had seen in the second wave. So people who had severe COVID infection and a bad lung reserve should also take the influenza shot. People who are healthcare worker, frontline worker, they should take. Now, what advantage this flu vaccine, even if a healthy person who is going to take this flu shot, what advantage it is actually going to give you? So supposedly I myself, though I'm a healthcare worker, I regularly take it every year, but I myself, if I take the vaccine, what benefit is there? I will not get infected or not have severe symptom, not have a frank viral replication in my throat if I'm vaccinated with the current strain, and I will not give it to my family members also. So if a good herd immunity is there, so annual vaccination, this is why we are annual vaccination. This is the concept of it, that a good amount of at least people who are at risk, they should take the vaccine. And the advantage of a healthy adult also getting the vaccination, that the family also get a lesser chance of getting exposed to this virus.
Okay, but now, can I just ask you, this is a culture, Doctor, this is a culture we've seen in a lot of Western countries, but you know, in India, taking an influenza shot is not considered to be absolutely important every year. So are we moving in that direction? Is there no other way that we can boost our immune systems? Yes, Dr. Gupta.
Yeah, so world over, by all the professional bodies and all the authorities, an annual flu shot beyond the age of 6 months is recommended. And it not only it may prevent infection. Even if it doesn't prevent infection, it attenuates or decreases the intensity of the infection, as well as decreases rates of hospitalization. So as it was mentioned earlier also, that people who are healthy, they should also take vaccine, because the overall transmission of the infection would certainly decrease. So from a public health point of view, despite the fact that it is important, so despite the fact that it may be a mild illness in majority of the patients, still the person has to remain restricted at home. The professional work gets upset. The overall the quality of life also subsequent to the infection gets deteriorated by means of fatigue, and sometimes lingering complications like persistent cough is there. So overall, the benefits of the vaccination far outweigh any other concern. Which may
but can I ask you, Mr. Gupta, what I was trying to understand from you earlier is, obviously flus have existed all the time, and of course December or change of season is considered flu season in India as well, but we've never had a problem which has been this bad across the country, of such long duration coughs and congestions, etc. So do you believe this is just like a mutation that has happened in the virus alone, or are we compromised because we've had COVID bouts and therefore we are, you know, more subjected to these seasonal flus as well? What is going on? I mean, why has this suddenly become a thing in India?
Probably because after the emergence of after COVID, everybody got sensitized with the respiratory illnesses. Now, since COVID was on the decline till very recently, suddenly there's spurt of cases of respiratory or acute respiratory, upper respiratory tract illness or an influenza-like illness started appearing. So those things, those memories start coming back. And once we hear that 1 or 2 deaths have been reported somewhere, so that also creates a scare. But the thing is that the attitudinal change should be there in terms of adoption of what we call a COVID appropriate behavior, or for any respiratory illness, usage of vaccine, usage of mask, hand washing, etc. That is important. So, and this sensitization has not been there in our country. That probably lies, the responsibility lies with the healthcare community, the doctors community, so that we should tell the patient that this is an advantage, and more people will start taking the vaccine.
Dr. Baidya, I want to give you a word also on what you would recommend people should or should not do, and what should they do if they feel they're catching on to a flu or a virus like this?
So, Shivani, we need to understand that this virus is also spreading through a droplet infection. So, what you all can do, as we have learned in the COVID era, that we need to wear a mask with same way we can be protected from flu also, and also the circulating strain of COVID. Proper hand hygiene, and yes, vaccination. To all these three is important. If you are having any symptom of influenza-like illness, so just in the initial phase only, because what for the flu we see that the incubation period is very short. It is around 1 to 2 days. So usually if a family member catches infection, the other family member will start showing the symptoms in next 1 to 2 days. So as soon as you feel that there is scratchy throat or nasal congestion, start at least wearing a surgical mask. A simple 3-layered mask will help you that your family member might not get affected if the virus still not got transmitted to them. Practicing hand hygiene. So these basic precautions, as we were protecting ourselves from COVID, the same will help in the influenza pandemic also. I'd like to add one point, Shivani, that you asked about why we are seeing so much N3 and H3N2 cases this year. So one thing that what we had seen in last 2 years, people were wearing masks. So the usual circulating influenza antibodies, influenza infection, which also transmit through this way, this route only, was less. The herd immunity was less. People were not vaccinated as such. Another thing, the damage done by COVID itself as a viral infection to our lungs has also triggered a bad influenza and a prolonged illness because of influenza virus itself, which is actually influenza A can be associated with mild, moderate to severe influenza infection. As such, a vaccine is always recommended. As Dr. Gupta has also mentioned, above 6 months of age. And if we just weigh the benefit out with the risk of getting vaccinated or the cost of vaccine, it is much more if you get yourself vaccinated. The benefits are much more when you get yourself vaccinated.
But I think, and I want both of you to take 30 seconds to talk about this. How do we really recover from what COVID and similar viruses have done to our immune system? Because ultimately boosting our immunity is going to be very important than relying on flus and on shots and vaccines all the time. So I want to talk to you, Dr. Baidya, do you want to take 30 seconds on what you think people should do to boost their immunity to begin with?
So quickly, Shivani, immunity cannot be built in a day. So you have to have a routine, good lifestyle, including a good diet, a daily routine of exercise, and a good hydration, taking adequate amount of water, adequate amount of nutrients. You should definitely go and check your vitamin D levels. This is important immunomodulator when it comes to immunity. Vitamin C rich food, including a vitamin C rich food in your diet, also helps to strengthen your immunity. So daily basic steps of working towards immunity helps to maintain it well. Doing yoga and everything we know since ages, but how much are we practicing? That's the question. So this few steps that I have mentioned that has to be followed if you want to build up your immunity gradually over days.
Dr. Gupta?
Yeah, so the immunity, we use this word so frequently, and anywhere, any illness or any situation, we always say that yes, immunity is the first thing. And in fact, any infection, it happens only because of an interaction between the virus or the bacteria and the host response or the immunity. Now, as we mentioned, that the fundamentals remain the same. Healthier lifestyle, which means regular exercise, at healthy diet, which should include also balanced diet, healthy and balanced diet, which should include appropriate amount of carbohydrates, proteins, dairy products, and fiber, etc. And thirdly, freedom from mental stress, or at least mitigation of mental stress to whatever extent is possible. Because this aspect is often neglected.
Yeah, absolutely.
Or not
absolutely.
Even, it is always
Yeah, I mean, stress is, of course, an addition. Not to forget, of course, the pollution that we're living in. It is not really helping our immunity, certainly not our respiratory system.